New guidelines are released from the American Stroke Association with the goal of saving more lives. Strokes have risen to the fourth leading cause of death in the U.S. With help from CT technology, doctors can now identify blood clots earlier. Previously, the standard time to administer clot-busting medication was about 4.5 hours, but new recommendations can now extend beyond that time.
The new guidelines indicate we can rely on our CT scans and CT angiograms to help identify those patients who may still have the clot-busting medication even beyond the 4.5-hour time window.
Officials say when someone is having a stroke, every second counts to help that treatment work more effectively.